Your go-to channel for all things health. I'm Rostam, and today we're diving into a crucial topic: stroke signs in women. Women often experience unique and unusual stroke symptoms that can easily be missed or dismissed. We're breaking down 10 unusual stroke signs in women that you should never ignore. We'll cover what to look out for, why it's important to act fast, and how to empower yourself with knowledge. Make sure to like, subscribe, and comment for more health tips and information. The first unusual sign is sudden confusion or trouble understanding. This can be alarming and disorienting, especially if it happens out of the blue. This doesn't necessarily mean forgetting your own name or having a complete mental lapse. It can be more nuanced and subtle. It can be much more subtle, like feeling foggy during a conversation. You might find it hard to keep track of what's being said or lose your train of thought unexpectedly. You might struggle to follow along or articulate your thoughts. This can be frustrating and can make you feel disconnected from the conversation. This confusion can manifest in different ways, like trouble understanding what someone is saying or difficulty expressing yourself. You might find it hard to find the right words or feel like your thoughts are jumbled. It's like a disconnect between your brain and your ability to communicate. This can be particularly concerning if it happens suddenly and without warning. This happens because blood flow to the brain's language centers is disrupted. When these areas don't get enough oxygen, they can't function properly. If this confusion comes on suddenly and is accompanied by other stroke symptoms, seek immediate medical attention. Time is of the essence in these situations. Remember, time is brain when it comes to strokes. Every minute counts, and the faster you act, the better the chances of minimizing damage. The faster you recognize the signs and get help, the better the chances of a positive outcome. Early intervention can make a significant difference in recovery and long-term health. Another unusual stroke sign in women is sudden vision problems. This can manifest in several ways, not just complete blindness. Common issues include blurred vision, double vision, or vision loss in one eye. Imagine closing one eye and noticing your field of vision is cut off on one side. This can happen when a stroke affects the optic nerve. Stroke-related vision changes tend to be sudden, painless, and persistent. They don't go away if you blink or rub your eyes. If you experience any sudden vision disturbances, especially with other symptoms, don't wait to see if they pass. Call 911 immediately. Early intervention can make a significant difference. Let's talk about a stroke symptom often mistaken for something else: a sudden severe headache. This type of headache can be alarming and is often misunderstood. This isn't your typical dull ache or throbbing sensation that you might get from a tension headache or a migraine. It's a sharp, excruciating pain, often described as the worst headache of my life. People who experience it say it feels like a sudden, intense explosion in their head. This happens because a stroke can cause bleeding or pressure in the brain. When a blood vessel bursts or is blocked, it can lead to a buildup of pressure that results in this severe pain. This headache might be accompanied by other symptoms such as nausea, vomiting, dizziness, or confusion. These additional symptoms can make it even more frightening and disorienting. Not all strokes cause headaches, and not all headaches are caused by strokes. However, it's crucial to recognize when a headache might be a sign of something more serious. But if you experience a sudden severe headache that's different from any before, seek immediate medical attention. This could be a life-saving decision. Remember, time is of the essence when it comes to strokes. The faster you get help, the better your chances of recovery. Don't try to tough it out or wait for the headache to pass. Ignoring the pain could lead to serious consequences. Call 911 or get to the emergency room as quickly as possible. Quick action can make all the difference in preventing long-term damage or even saving your life. Next up, sudden dizziness or loss of balance. This isn't the kind of dizziness you feel after spinning around. It's a sudden, intense feeling of vertigo, like the room is spinning. You might feel unsteady on your feet, like you're about to faint or collapse. This happens because a stroke can disrupt blood flow to the brain's balance centers. Stroke-related dizziness tends to be more severe and sudden. It might also be accompanied by vision problems, slurred speech, or weakness on one side of the body. If you experience sudden dizziness or loss of balance, seek immediate medical attention. Call 911 or have someone drive you to the nearest emergency room. Early intervention is crucial. Now, let's move on to a classic stroke symptom: sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. This is one of the most recognizable signs of a stroke, and can be quite alarming when it happens. This numbness or weakness can come on suddenly without any warning. It can be so abrupt that you might be in the middle of an activity and suddenly find yourself unable to continue. You might notice that one side of your face feels droopy or numb. This can be particularly noticeable when you look in the mirror or when someone else points it out to you. You might have trouble smiling or raising both eyebrows evenly. This asymmetry is a key indicator that something is wrong and should not be ignored. In the arms or legs, this weakness might feel like heaviness or a lack of coordination. You might find it difficult to lift your arm or leg, or you might stumble when trying to walk. This happens because a stroke disrupts blood flow to the brain's movement and sensation centers. When these areas of the brain are deprived of oxygen, they can't function properly, leading to the symptoms you're experiencing. Stroke-related numbness or weakness tends to be more persistent and severe. Unlike temporary numbness that might come from sitting in one position for too long, this numbness doesn't go away with movement or time. It might also be accompanied by other neurological symptoms, such as facial drooping or slurred speech. These additional symptoms can help differentiate a stroke from other conditions. If you experience these symptoms, seek immediate medical attention. Time is of the essence when it comes to treating a stroke, and the faster you get help, the better your chances of recovery. Early intervention can make a significant difference. Quick medical response can help minimize the damage to your brain and improve your chances of a full recovery. Always remember, when it comes to a stroke, every second counts. Let's talk about sudden trouble speaking or understanding speech, known as aphasia. This difficulty with language can manifest in different ways. You might have trouble finding the right words to express yourself. You might speak in jumbled sentences or use nonsensical words. Alternatively, you might have trouble understanding what others are saying. This happens because a stroke can damage the brain's language processing areas. Stroke-related speech problems tend to be sudden, severe, and persistent. They might also be accompanied by other neurological symptoms, such as facial drooping or arm weakness. If you experience these symptoms, seek immediate medical attention. Early intervention is crucial. Let's delve into another unusual stroke sign in women's sudden trouble walking. This isn't about tripping over a rug or feeling a bit unsteady. We're talking about a sudden onset of difficulty walking, characterized by stumbling and lack of coordination. Imagine feeling like your legs have turned to jelly, making it nearly impossible to walk in a straight line. This happens because a stroke can disrupt blood flow to the brain's motor control centers. When a stroke affects these areas, it disrupts coordination, leading to ataxia. You might find yourself swaying or taking wide, unsteady steps. If you experience sudden trouble walking, seek immediate medical attention. Early intervention can make a significant difference. Now let's discuss a stroke symptom often overlooked, sudden nausea or vomiting. While these symptoms are commonly associated with stomach bugs, they can also be red flags for a stroke. Imagine experiencing a wave of nausea that hits you out of the blue, followed by an uncontrollable urge to vomit. This happens because a stroke can affect the brain's vomiting center. Stroke-related nausea and vomiting tend to occur suddenly and without warning. They might also be accompanied by other neurological symptoms, such as a severe headache or dizziness. If you experience these symptoms, seek immediate medical attention. Let's address a stroke symptom that's often subtle sudden fatigue. This is a different kind of fatigue, a sudden overwhelming exhaustion that comes on without warning. Imagine feeling like you've hit a wall, your energy completely drained. This happens because a stroke can disrupt blood flow to the brain's energy regulation centers. Stroke-related fatigue tends to be more sudden, severe, and persistent. It might also be accompanied by other neurological symptoms, such as a headache or dizziness. If you experience these symptoms, seek immediate medical attention. Finally, let's discuss a stroke symptom often associated with another serious condition, sudden chest pain. While chest pain is most commonly linked to heart attacks, it can also be a sign of a stroke. Imagine experiencing a sudden tightness or pressure in your chest, a feeling that might radiate to your arms, jaw, back, or neck. This happens because a stroke can affect the brain's heart rate and blood pressure centers. Stroke-related chest pain might be sharp or feel like a crushing weight. If you experience sudden chest pain, call 911 immediately. Time is of the essence when it comes to both heart attacks and strokes. Seek immediate medical attention and let the experts provide the appropriate treatment. And there you have it. 10 unusual stroke signs in women that you should never ignore. By being aware of these symptoms, you're empowering yourself to act quickly and potentially save a life. Thanks for watching Healthcare. I hope you found this video informative and helpful. Don't forget to like, subscribe, and comment below.